There are so many myths about how to treat poison ivy rash floating around the internet. And I'm here to bust some myths for you about poison ivy treatment. Hi, I'm Dr. Megan, the Prednisone Pharmacist, and I've got 9+ myths to bust for you about treating poison ivy. So, why would I even be answering this? Well, first of all, I have a patient who wrote me this email, and it includes one of the myths. You'll have to listen towards the end to find out which myth this one is. She said, "Hi, Dr. Megan. I currently have poison ivy and have finished day 4 of the 6-day blister pack. The poison ivy doesn't seem to be getting any better. It's still itchy in 2 main spots. Contacted areas are developing from small circles to larger rash areas. Is it advisable, or will it help me to extend my taper to take 2 doses of 4 milligram pills each day starting tomorrow, then 1 dose of the 4 milligram pill for a few days after? I have another prescription for it," and she means the Benadryl dose pack, "but I'm unsure what the value, if any, would be of extending the taper. Thank you." So that is why I'm speaking today, is because people are wondering, how long do I take prednisone? When will I feel better if I take prednisone? And what about all the other treatments for poison ivy? Do they work? What should I do? So myth number 1 is that if you brush by poison ivy, you're going to get a reaction immediately. And that's what I kind of figured is what it would be, having not personally ever been exposed to poison ivy myself. I've had like other rashes from bushes as I've been hiking in the woods, but I've never had poison ivy. And those rashes, they were pretty quick, within about 15 minutes. But that's not necessarily how poison ivy is. Poison ivy takes a little bit of time to react. Reaction from poison ivy can be anywhere from 4 hours to 4 days. And if it's your first exposure, it's even possible to go way out to 21 days after your exposure to have a poison ivy rash. Kind of mind blowing. That's at least how I felt. Myth number 2 is that if you immediately take a hot shower, that can help. And it's a little more nuanced than that. So, first of all, what is causing this reaction? And it's oil that is inside the plant. You have to actually like break the plant in some way in order to be exposed to the oil. It's called urushiol, and it's from the Japanese meaning lacquer or resin. It's like it coats you. It's sticky. It's this oil, and if you just use straight up water and straight up hot water, it's not really going to get rid of it. You actually need to use something that is going to dissolve that oil. If you know you were exposed, you want to immediately put gloves on and use the gloves to take off contaminated clothing. That's step 1. Step 2 is you're going to wash at least 3 times after the exposure. But how do you wash? So that comes to myth number 3. And that you have to go and buy some fancy, expensive poison ivy treatment. That's not true. Instead, they've done studies and shown that using a dishwashing soap like Dawn, that lovely blue, gentle dishwashing soap, on a washcloth is as effective and a lot cheaper than the fancy, expensive oil remover treatments. If you do it, you put the soap on a washcloth, get it wet, and then you want to wipe in the same direction. You don't want to rub, because that might rub the oil into places that it wasn't. So you want to just rub away and then rub away and keep rubbing in one direction, and then rinse out the cloth. Do it again, rubbing in one direction, and do that 3 times with a soapy dishcloth. There are no fancy, expensive treatments for poison ivy that work. And there is one possibility, and that is if there is a cream or an oil that is designed specifically for poison ivy for people who are exposed to it often, and it's designed to create a barrier to protect your skin in advance of exposure, is designed specifically for poison ivy for people who are exposed to it often. And it's because you're like a firefighter or a landscaper or something, and you're frequently exposed to it, then those may be somewhat effective. So those ones might help. I've heard maybe one called Technu. It might be helpful. So those ones have some evidence that they can help. Myth number 4, poison ivy can spread to other people. And this is false, at least the rash can't. poison ivy rash, the contact dermatitis, is not contagious. It cannot spread to other people, even if you have blisters and they pop. What is in the blisters is not actually poison ivy. It's not the urushiol. It's actually your body's reaction. It's like the white blood cells and the pus, all of that stuff is not actually the poison ivy. What is true about this is that urushiol oil, it can get under your fingernails. It can be on your pet. It can be on your clothes. It can be on your garden tools. It can be on all of these things. And that can spread. Like your dog going around your house after being, like the dogs usually don't get a reaction like humans do. But if that dog tracks this around the house, yes, that can spread it. So cut your fingernails, get the oil out from underneath your fingernail beds, wash them really well with that dish soap. Myth number 5, anti-itch medicines help relieve itching. Anti-itch medications like Benadryl, those are so helpful for relieving itching. And that's what you'd normally think when it comes to itching. But when it comes to poison ivy itching, it actually doesn't have evidence that it helps. And people who take this kind might be like, well, I need it so I can sleep at night because I itch at night. And the studies show that even if you take it, the amount of itching doesn't change. Like the amount of scratching of the itch doesn't change. And the quality of the sleep is worse. So only take it if you're completely desperate and like you absolutely cannot sleep otherwise. And you've taken it in the past and you know it helps you sleep, because there's a few people that actually that makes them wide awake. What about antihistamine creams or lotions or anesthetic creams containing like numbing things like benzocaine? Those are not helpful and are not advised. So avoid those. They are just not the best thing for you. Here's another one. Myth. If you get a skin infection complication, like your blisters pop or your scratch gets so bad that it bleeds and then it starts getting infected, just use an over-the-counter antibiotic to rub in there. And that is a myth. The truth is you should avoid antibiotic ointments or creams containing neomycin or bacitracin to the skin when it is that reactive and inflamed, because they could actually make the rash worse. In addition to that, many people are allergic to those ingredients, and the actual top reaction, like contact dermatitis, is actually as common from those ingredients themselves as like they're the most common cause of contact dermatitis. So we don't want that. And these days, many bacteria are actually resistant to these drugs. So if you are getting an infection, you need to see a doctor and get an oral antibiotic to treat it, because the creams and ointments are not good enough for this kind of an infection. Okay, speaking of creams and ointments, myth number 7, and that is that steroid creams should be avoided. I just mentioned all these other kinds of creams to avoid. So do we also avoid steroid creams? And the answer here is actually no, you should not avoid them. Potentially, if used within the first few days, steroid creams can be helpful. If you get symptoms and they're itchy and they're red and it's getting swollen, then a steroid cream can help. But the over-the-counter available kinds, the kinds you don't need a prescription for, such as hydrocortisone 1% cream or 0.5% cream, are too low of a dosage, of a potency to actually work. They're not usually very helpful. They're just not quite enough to get you over the edge. And so you usually need a prescription strength steroid cream. But if you were to use a prescription strength steroid cream, they are often expensive and they don't necessarily work as well as a pill or an injection. So that takes me to myth number 8, which is that everyone who gets poison ivy should take prednisone, which is the pill, the steroid pill that is most common. People may also be prescribed methylprednisolone or Medrol dose packs for poison ivy treatment. The truth of the matter is most people throughout history have survived without steroid treatment. For the majority of people who are exposed to poison ivy, doing nothing is going to be just fine, and your symptoms will resolve within 1 to 3 weeks, because somehow we've survived as a species, even though poison ivy has been a constant bane to our existence. even if you are exposed, you don't absolutely have to take a prescription steroid to treat it. You only want to take a prescription steroid like prednisone for poison ivy rashes if it is severe. And I mean severe. Talk to your doctor about what that means between the two of you. Be very clear about precisely how severe your situation is. Generally, severe means it's covering at least a fourth of your body. It's in a very sensitive area, such as your face, your eyelids, your mouth, your genital areas, and involving 2 or more body areas. So it's got to be bad, right? Like it needs to be bad. And why does it need to be bad to justify using prednisone? Because the side effects of prednisone itself are terrible. I can't tell you the number of people who have called me, emailed me, messaged me saying, I wish I had never taken prednisone for this silly rash that was going to go away on its own. Generally, poison ivy rash will go away on its own. So if you can possibly tolerate it, avoid the prednisone. Definitely talk to your doctor though. Why do I say that? Because I personally had to take prednisone, and I've talked to thousands of people who've taken prednisone, and I've discovered that prednisone can cause up to 150 side effects. And some of these side effects are even worse than poison ivy. I know that's hard to believe if you're suffering poison ivy, how miserable it is. But believe me when I say there are some horrible, disabling, debilitating, and like disfiguring side effects to prednisone that you want to avoid if at all possible, unless you have something severe going on. Okay. So they did a study of people who took prednisone for poison ivy. The side effects that they had included weight gain, anger, hyperactivity, insomnia, and nausea. And I have a whole chart of possible other ones, a searchable list to be like, is this poison ivy getting worse? Is this something else? Or is this a side effect of steroids? You can search that list. And then that brings me to myth number 9. And it's that steroid treatment, either with prednisone, methylprednisolone, the Benadryl dose pack, is only needed short term, and then you'll know right away if it works. And that is false. That is a complete myth. They used to think a short treatment with a low dose, like generally that's what I advise people, like expose yourself to the least amount of steroid possible. But if the prednisone is going to actually do its job in poison ivy, it needs to be a really quite high dose. The Benadryl dose pack actually isn't high enough for most people. And so you really need between 40 to 60 milligrams of prednisone per day for at least 5 days, if not longer. So back to this study, they compared people who were given 40 milligrams of prednisone for 5 days to people who were given 40 milligrams of prednisone for 5 days and then tapered slowly to a total of 15 days of treatment. So 10 days of tapering, doing 30, 20, 15, 10, 5 milligrams over time. Okay. For those people, it showed that a longer treatment was more effective than a shorter treatment. So a 5-day prednisone dosage just probably isn't enough. You can have rebound rash and itching coming back because it just didn't last long enough. That urushiol is just wicked in its ability to cause our body to really react. Related to that, it needs to be at least 14 days and often up to 21 days of treatment. And depending on your size, you might need a higher dose, or depending on the level of severity of your rash, you might need up to 60 milligrams per day. Between 40 to 60 milligrams generally is the dose for adults. If you were to take it, how fast does that prednisone work for poison ivy? And I've seen things online that say, oh, you'll know it'll work really fast. And you might get some relief fairly quickly. You might get some itching or some swelling that goes down. But in that study, they asked people, when did you first get relief? The mean time to improvement, the average time to improvement of their poison ivy was between 3 to 5 days. So it wasn't immediate. It wasn't after that first dose, as generally is seen with most reasons people take prednisone. And then for those people who took it for longer than 5 days, when did the rash finally resolve? When did it go away? And the average or mean time to resolution was 11 to 15 days. So it was about 2 weeks before people saw the rash resolving. And that's why you want to continue the treatment beyond 5 days to 14 to 21 days instead. So prednisone works after 3 to 5 days, and you need to take prednisone 14 to 21 days. So a bonus myth is that, okay, I have to take this horrible steroid because I have this horrible rash, and there's nothing I can do about all of these horrible side effects. I have 150 possible side effects, and there's nothing I can do about it. Well, thankfully, I'm here to tell you that that is false. That is a myth. There are things you can do about prednisone side effects. And to help you out, I created a downloadable PDF, free. It's called the Prednisone Checklist, and it goes through the side effects and what you can do about them, my top tips of how to cope while on prednisone. So you can just click the link below to download your free prednisone checklist, so that if you have to take prednisone for poison ivy, you won't feel nearly as awful as those poor people who don't know what you'll know by downloading this checklist. Signing off as Dr. Megan, your prednisone pharmacist. I'm here to help you not just survive prednisone, but to thrive while on prednisone.